So we get a lot of flack from the government and from the crooked ass media that is beholden to the obviously the pharmaceutical industry and of course the oil barons. Because if you turn on your regular old cable TV and see what's going on the news, more than likely you're going to get inundated with pharmaceutical corporation just mambo jumbo. Proven fact, they spend way absorbent amounts of money on marketing and advertising. It's half the reason why some of the drug costs are so high. Besides the fact that in America they're allowed to gouge you. They have no if you pay attention to politics, they have no restraint on gouging you. They have no restraint on making people that are dependent on medicine basically pay the piper or don't get the medicine. You've seen how drug companies negotiate with Medicare to give them the best possible deal that they can. And then in California, California tried to pass a law where they put it on the ballot and people were allowed to vote for it. And what it would have done is it would have made it so the VA or so that everybody could negotiate like the government does on prescriptions. And come on, man. Now you have the government telling you that you can only do research on medical marijuana if you use the marijuana that they provide you. And the DEA did say something about how they were going to let it, more people grow medicine or test their medicine or whatever they said. They haven't let anybody else do it yet. And currently the only way to get marijuana from the government is through the National Institute on Drug Abuse. And it all comes from the same farm, the same government farm that's been growing marijuana since the 60s in Old Mississippi College, University of Mississippi, Old Miss. I am remiss because I forgot the guy's name, who's the doctor that's been the sole proprietor of this program since its inception up until I think current day. There is some other people there, and they are talking about growing better crops. They've been talking about growing better crops since Sanjay Gupta paid the place a visit a couple years back, and I haven't really seen anything in the way of improvements coming out. And then we get this. So somebody wanted to test, they wanted to do some PTSD experiments, and the National Institute on Drug Abuse sent them the marijuana that you're seeing in this picture now. The one in the middle, that green bowl there full of what looks like lawn clippings mixed with who knows what. And it looks a lot like oregano. Maybe throw in some parsley and a little bit of thyme, and you have the makings for a delicious bisque spread. Just put that on your meat and let it sink in there all day, and then throw that in the oven, slow roast it. It comes out great. But I would never want to use this to do a medical marijuana experiment. And this hurts everybody. It don't just hurt us because we want the research. We need the research. This is a PTSD study that MAPS is doing. And, how can they get any data using this garbage? Doesn't even look like a placebo. Like a placebo with absolutely nothing but sugar in it might be more like marijuana than this stuff, or maybe not. So I stumbled across this in a New Zealand article, which actually a couple days ago. Of course, the date there is today's date because New Zealand, they're a little quicker than us on days changing. And they show you this first picture. This is what you would expect to get if you went and bought yourself some marijuana at a typical dispensary in America, where there are standards and you have to have certain quality standards. There's a lot of places where there's dispensaries that don't have standards and you don't have to get tested and stuff like that. But if you did have to go get tested and you were paying an exorbitant fee of anywhere from $12 to $25 a gram, I've heard, for weed that looks this good, you don't want to get you don't want to test, you don't want to do a lab test, a controlled experiment with some crazy oregano looking shit. So I'm going to read this. But if you're a researcher looking to work with marijuana to, say, investigate how it impairs you or how it could help people suffering from certain ailments, you don't have access to the weed that everybody else is using. Since the late 60s, the federal government has mandated that all marijuana used in research has to come through the federal government. More so, they just have to be grown by them. And that basically monopolizes all research because, nobody's ever really tried this research thing before the 2000s, maybe a little bit in the 90s, but not much. The National Institute on Drug Abuse supplied marijuana as received by Sue Sisley from the Multidisciplinary Association of Psychedelic Studies, otherwise known as MAPS. They're also doing studies with MDMA, psilocybin, small doses of LSD, ketamine. Sorry. And, I'm sure when they get those drugs, they're getting something pure, something that's as high of quality as the world standards allow for. So what is the National Institute on Drug Abuse? What business do they have shipping this garbage out to the people that are trying to do studies? And now, like I said, this isn't good for them either. Like, when I say them, I mean like the government who wants to tell you how dangerous marijuana is. Now, granted, this shit's going to be dangerous if you try getting high off it because you're going to have to smoke so much of it, it's going to ruin your lungs. But does that mean that marijuana's dangerous? No, it don't. And does that mean that good marijuana, like what you buy at the dispensary, does that mean that shit's dangerous? No, it doesn't. Just because this garbage is dangerous doesn't mean that shit is. To investigate the real-world effects of marijuana, researchers need a product that looks and feels like the real thing. And they're increasingly frustrated with government weed that is something else entirely. Don't take their word for it. The photo below shows a sample of federal marijuana distributed to Sue Sisley, a researcher who disembarked on the first of its kind clinical trial to test the efficacy of medical marijuana for military veterans suffering from PTSD. And there it is again. Oh, I mean, come on, man. Really? I started smoking weed in the 80s, like the early 80s, and I've seen a lot of garbage throughout my life, but I will vouch for never seeing anything like that. I mean, I wouldn't even, if someone sold me that or tried to, I would have to say that, no, this is oregano. I couldn't honestly believe that there's any marijuana at all in there. A quick glance confirms it's nothing like the commercial marijuana depicted above. While the real stuff is chunky and dark green, the government weed is stringy and light in color. It appears to be full of stems in which most consumers don't smoke. It doesn't resemble cannabis. It doesn't smell like cannabis, Sisley told PBS NewsHour last week. Jake Brown, a cannabis critic from the Denver Post's cannabis marijuana news site, agrees. Quote, "This is flat out not a usable form of cannabis," he said. Brown should know he's reviewed dozens of strains professionally and is running a sophisticated marijuana growing competition called the Grow Off. Quote, "In 2 decades of smoking weed, I've never seen anything that looks like that," Brown said. People typically smoke the flower of the plant, but here you can clearly see stems and leaves in there as well, parts that should be discarded. Inhaling that would be like eating an apple, including the seeds inside it and the branch it grew on. And I would argue, and then not really eating a whole lot of the actual meat of the apple itself, because it doesn't look like there's really a whole lot in there. All federal marijuana is grown at a single facility at the University of Mississippi, overseen by the National Institute on Drug Abuse. Last summer, the DEA formally took steps to allow other entities to supply marijuana for research purposes. So far, none have been approved. And if you think the DEA is in any kind of a hurry or has any motivation at all to move them applications along and get right on, approving, I wouldn't hold your breath. The problem with the Mississippi weed go well beyond aesthetics. For instance, the pot grown there maxes out potency-wise at about 13% THC. Well, not that shit that you showed me a picture of. No way. And THC, of course, is the main chemical that gets you high. And it's also one of the main components of the entourage of components known as the cannabinoid entourage, which is a whole, cornucopia of cannabinoids and terpenoids and other things that together make a natural plant that you can pick and use right without doing anything else to it. That's what makes it medicine. All right. So if you don't have any THC in there, or by the looks of this, it doesn't have much of anything in it. Terpenoids couldn't survive whatever happened to this shit. Right, that might be an overstatement. Sicily's own testing found that one of NIDA's strains purported to be 13 was actually closer to 8. From Inverse, we have another take on this. Many other scientists have expressed frustration about the issue. In an interview with the Chronicle of Higher Education in February, Nicholas Lobrick, professor emerite of political science at Washington State University and chair of its Cannabis Committee on Research and Outreach, said, quote, "We can't get very far with the Mississippi weed. That's just the reality." And University of California, San Diego psychiatrist Ty Brumbach, PhD, who studies the effects of the drug on adolescent brain development, told Inverse in a previous interview that over the last 20 years, the levels and concentration of THC have increased exponentially. The supply from the University of Mississippi is not the same as what people can get on the street. There's a disconnect there. And I would argue that they probably are, I don't know if there was even any tests that they conducted 20 or 30 years ago at the University of Mississippi. I'm sorry I didn't look into that, but I'm kind of curious to know. And when they were using that shit, even back then, the average marijuana on the street was definitely higher THC content than that garbage that we've seen in the picture. Like 8% is giving that some credit. But the stuff on the streets were, somewhere in the 10% range to 15% for the really good stuff back in my heyday, back in the 90s, 80s. When I first started smoking weed, there's definitely a disconnect, man. I would not smoke the shit if it looked like that. I'd put it on my pizza. By comparison, a typical commercial weed available in Colorado is about 19% THC, according to a laboratory that tests commercial marijuana in the state. And that's just the average. Some of the higher end strains are pushing 30% or more. For a researcher, it's difficult to assess the real-world impact of high-end pot if you only have access to low-quality stuff. It's akin to investigating the effects of bourbon by giving people Bud Light. For certain types of research, this isn't necessarily a problem, says Rick Doblin, founding director of Multidisciplinary Association of Psychedelic Studies, a group that's been working with Sicily on the PTSD trial. National Institute on Drug Abuse is marijuana is fine if you want to do an academic research. Doblin said, studies that look at how marijuana affects the body in a laboratory setting, for instance. And I'm guessing even with those, you're going to do some extractions or something. You're not just using this raw oregano-looking shit to do any kind of a study. But NIDA's weed doesn't pass muster if you want to know how marijuana use is affecting people in the real world, or if you want to run highly controlled medical experiments like the ones Sicily and Doblin are working on. It's not even tested for some common contaminants like yeast and mold that many states now check for as part of their regulatory regimen. Doblin says the marijuana they've received from NIDA shows levels of mold and yeast that far exceeded standards for some states like Colorado and Washington, but they opted to go ahead with the trials since additional testing confirmed that none of the strains of mold or yeast found in the plant material posed a risk to humans. So, tell them that, and then tell them to go look at the weed that they keep writing articles about and how the mold and the medical marijuana is killing people or doing anything bad to people, really. So in an email, a NIDA representative acknowledged that there has been some emerging interest from the research community for a wider variety of marijuana and marijuana products. NIDA does plan on growing some additional marijuana this year and harvest some high THC material that will likely be above 13% THC. They're hoping, like, maybe they can, maybe they can't. We are talking about the University of Mississippi, where if you're a grower out there, and like me, when you first got into growing, or maybe somewhere along the line, you stumbled across G13 genetics. Now, G13 is the strain that purportedly, rumor has it, was one of these strains that were grown in the secret government lab, Old Miss, and they grew these different strains, and they grew this G13, which is the strongest weed in the world, and all this crap. Look it up sometimes. It's an interesting read, but the G13, I grew it. It wasn't super impressive, but I mean, we're talking about I just grew it like 5 years ago, where THC averages are 20 or more, and that stuff might have come out at 15, might not have, but it was good. I mean, it tasted good, it looked good, but now that I see this, I don't think I believe it. Or maybe if I do, then they purposely are sabotaging medical marijuana research. That's basically the only conclusion you can come up with, especially if G13 really was something that escaped their secret marijuana lab, which has never really been a secret, and it's not really a lab. And furthermore, I don't think the person running that really cares about that kind of thing. Like he never had an ambition to breed for high THC or whatever. And if he did come up with that, it was just because he accidentally stumbled on it. THC's isolation back in the 1960s was done in Israel. Virtually nothing that you could attribute to this Mississippi lab, like not even the patent that the U.S. has on medical marijuana for the different things that they patented it for, antioxidant and neuroprotectant and all this stuff. I don't think any of those tests were even done at the University of Mississippi. They might not even have used marijuana procured from there, or they did, or I don't know. I'll have to look into that more. But the bottom line is you have to believe that this is sabotage. Like everybody wants marijuana studies. The government wants to keep pushing propaganda that marijuana is dangerous, marijuana is not safe medicine, marijuana is this, marijuana is that, and they can keep on saying it with no studies. I argue that you should have studies to back up whatever you're saying. Otherwise, you just look like Jeff Sessions' creepy old ass sitting there just telling you what his opinion is. And his opinion that it's dangerous, his opinion that it's a gateway drug, his opinion that it's leading to more violence out there, and so on and so forth. We don't care about opinions. We want real data from studies. We want to know what, that's the intelligent approach, right? You don't want to go stupid about it. That's what we're asking for. We're not like, hey, legalize marijuana. We don't give a fuck if it's dangerous. No, we want studies just like you do. And just like when we say something about marijuana that you don't like, you say we need a study. Well, we say you need a study as well. If you want to say it's dangerous and you want to say it's, got these bacterias and molds in it and shit, and that it's causing this and it's leading to that, give me some studies. And don't, sabotage all the studies by giving people shit that's not even real medical marijuana. I mean, I don't even know what you want to call this garbage. You can call it whatever you want, oregano, spice. I mean, maybe this is the base that they use to make the fake marijuana with. Like, I don't know. I mean, the more they talk about marijuana, the less they're talking about fake marijuana. That's the shit that's dangerous. That's the stuff that kids are clinging on to these days. Because you're so focused on marijuana, now you got kids that have to take piss tests because you're worried about them smoking marijuana. Well, they know that they can beat the piss test by smoking fake marijuana. Marijuana overdose have never risen or fallen. They've always been right at zero. But fake marijuana overdoses, off the charts. This shit here that you send to the labs for people to try to do studies with, that's fraud. That is straight up fraud. You are sending counterfeit bullshit. You're sending straight up garbage to people. You can't do that. That's not what we signed up for. And if you don't let people just use the medicine that they can acquire at a dispensary, then you're already sabotaging the fucking experiment. But by saying that they have to use the weed that you provide them, and then you send them straight up garbage, you are definitely sabotaging this. And I think that the lab that got this marijuana should for sure sue. They're wasting money. This is a waste of money and time. They just sent this shit to this lab, And now they're like, well, we got to do what we got to do. You know, we got to deal with it. We got to just go forward, like, whatever. So I don't know. Things have got to change, starting with the DEA's stance on marijuana. We got to we got to do what Sessions told us to do. Talk to your congressman and tell your representatives that marijuana's got to come right off the schedule. You guys got to quit worrying about marijuana. Take it right off the schedule. Let states decide what to do with it. Let states do their own research on it. When did you? What other thing is there that you can think of where you can't research it? I don't care how dangerous it is. Look in the story about angel dust or PCP. Read about that sometimes. This is something they accidentally discovered in the lab, and then the DEA and the National Institute on Drug Abuse and all those people got together and was like, you know what? Go ahead and experiment with it for the next few years. See what you can do with it. Put it on Schedule 2 and 3. Let's just prescribe it to people for random shit. Let's see what we can do with it. See how we can make this thing work. I ain't even lying, man. Marijuana? Nope. You don't even get real weed when you want to do a legitimate test. Because they don't want you to do a legitimate test. They want your test results to look like shit. Like their fucking weed looks like.